We want to start with the latest COVID surge. The death toll on Wednesday surpassed the number of people killed on 9/11. How bad could this get in the next few weeks?
Well, really in uncharted territories. It's going to be largely dependent on what do we as individuals living out in our communities do to reduce our risk. My big concern is that if we go ahead with Christmas as normal, as many people are now planning to do, and we bring families together from distant locations, we have Christmas parties, holiday events in general, I think things could get considerably worse. So it's really in our hands, and it'll depend in large part what we decide to do with the holiday season.
We were looking at 3,000 people dead on Wednesday. You think that number could climb and be even more severe in days in the future?
Absolutely, it can. It's going to be dependent in part, again, on what we do with our activities and behaviors right now. Remember that the deaths that are going to occur over the next 2 to 3 weeks are pretty much already in the pipeline, meaning these are people who are infected already. There are people who are just now going to be hospitalized and then subsequently die over the 1 to 2 weeks after that. So we can't really impact this number in any meaningful way for probably another 2 to 3 weeks. But then at that point, hopefully we will see a change in case numbers and the number of deaths.
Should cities and states put in harsher restrictions ahead of Christmas, given the travel we saw ahead of Thanksgiving?
Well, I don't know what kind of conditions you can put into place that frankly would stop people from traveling, stop people from having family events. I mean, let's be honest, there's no way to regulate family events. If people want to get together, they're going to get together. And so all we can do is appeal to the fact that we want them to be around next year for Christmas, that we want them to be with us. And the only way that that's going to happen for some families, unfortunately, is if they don't have people who have not been either quarantined by themselves as a group or as a group for the past 7 to 10 days, or they live in the setting where they're now with other family members who also live there.
So what's your advice to people? What's your advice to people who are planning to travel for Christmas?
At this point, I have to understand that if you travel and you are having not been quarantined or isolated away, you might say, for those 7 to 10 days before you travel, then you surely can bring the virus with you. If you do travel, you're going to potentially get infected in the process of traveling, but you won't be infectious for at least 2 to 3 days after that. So if you travel, go home there for a day or two, then you very well may not, actually expose people wherever you're at to that virus, but you will after day 3 or 4. And that's what people have to understand.
Should people cancel travel plans?
At this point, this is our COVID year. This is the year where it's not like last year, and it won't be like it is next year. Hopefully with vaccines, it'll be a very different situation. If you can not limit your contact with someone who has themselves been bubbled up, meaning that they have not exposed themselves to others, if you can't do that, then you put yourself and your family at risk. I can tell you, having dealt with a number of situations following Thanksgiving, you don't think it'll ever happen to you, but it does. I have dealt with too many situations where mom or dad or grandpa or grandma are now dead as a result of a Thanksgiving Day event. People have to just keep that in mind when they're talking about getting together for Christmas. I know we want to be together more so this year than almost any other year, but in this COVID year, the greatest act of love you can actually share with your family is not exposing them or they exposing you to this virus.
I want to talk about the vaccines. We've seen tremendous efficacy in the numbers from Pfizer, from Moderna. The number for AstraZeneca, not quite as high. I'm curious, do you think that the vast majority of Americans are going to end up getting a vaccine that is less effective come spring because that's what's going to be available?
I don't think that's the case at all yet. I think the AstraZeneca data still need to be looked at carefully, and there are additional studies trying to understand just what that low dose, high dose combination meant. So I wouldn't write any of those additional new vaccines off yet as being any less than what we've seen with Moderna and Pfizer. My concern will continue to be making sure we have adequate amounts of the vaccine early on for those that are the early adopters and want the vaccine. And then I think the big challenge we're going to have is as we get into quarter 2, 3, and 4, is getting people who are vaccine hesitant, people who right now are concerned about the safety of the vaccines. They don't understand Operation Warp Speed. They don't understand what an mRNA vaccine is or a chimp adeno vaccine is. And we have to tell a story. We have a major obligation as the public health community to understand people's hesitancy and then to address them from a standpoint of safety and from vaccine efficacy.
Reports indicate that the Trump administration turned down Pfizer for an additional 100 million doses of their vaccine over the summer. Do you have any information on why they would have done that?
Yeah, I can't comment. I have no information that that is actually correct or why it might have happened.
If that's true, what would that mean for the number of vaccines that we actually have?
Well, we're all going to be looking at the total number of vaccines available over the course of the next 2 to 3 months. What I mean by vaccines, I'm talking about different companies. And then within each company, we're going to see how much vaccine we get. And, at this point, I don't have any more data than anyone else in the public as to what that number might look like.
Do you think Americans should be preparing for a vaccine shortage come spring?
I can't say that there will be a vaccine shortage. I think, again, it's going to be dependent on just what can get delivered. And it's going to depend a lot on how many Americans take the vaccine. My big fear continues to be that after the early adopters, the people who really want it in the first a quarter of the year, that we're going to see recommendations for vaccinating other populations that then won't come forward because of their fears about the safety of the vaccines. And that's where now we have a lot of work to do to help bring an understanding to these people just what these vaccines mean and the safety that we know about that.
President-elect Biden has said that the current administration does not have a detailed plan for vaccine distribution. Is that what you've seen?
I have not seen any plans. I'm not part of any of the transition team activity. I think President-elect Biden's statement stands for what it is. So I take it that that's exactly what's happened.
President-elect Biden is 78 years old. Are you advising him to get this vaccine as soon as it is available, maybe even in the next couple weeks?
I don't provide any of that kind of input into the campaign. They have their own medical experts that are working with the president-elect. I know him to be a very responsible man, so I'm certain he will get his vaccine when it's his time to get it.
Do you think he should get it as soon as possible?
I don't have any comment on that.
For the vaccines that are approved for vaccines that are approved through emergency use authorization, do you expect that there could be mandates either in the public or private sector from businesses for their employees or even public schools, public universities?
Yeah. First of all, we have to work out, can there be mandates for this vaccine if it is actually approved under emergency use authorization? There's been some confusion about whether that actually can happen. Second of all, I'm certain that there will be an effort made by some private entities to actually consider mandates for employment. We're already hearing about that, so I can't comment on what the legality of that is, how that might work. The same thing is true for public institutions such as schools and universities. But I know surely that that's going to be a point of important discussion. And we got to start dealing with it now, well before even the vaccines are starting to arrive in any quantity.
Do you know whose decision that is, whether or not those mandates can happen?
I don't. It means clearly it's going to be both a legal perspective as well as just, from a public good standpoint, whether or not companies or institutions can require it. I don't know.
40% of Americans, according to polls, still say they wouldn't take these vaccines. What does the federal government need to do immediately to boost that confidence?
Actually, we need a multi-pronged approach right now. And it's not just the federal government, it's the private sector. It's really all those in the medical community. And what we have to do, first of all, is understand what people's knowledge, attitudes, and beliefs are about these vaccines. If they're hesitant to take them, why? And we have to collect that information now so that we can actually then adequately address what it is that we need to share with them. I've been saying for some time, we need to tell a story. What is Operation Warp Speed? For some people, that's a term that scares them, that makes them think that somehow this vaccine had shortcuts taken to get through the process. We have to explain what are messenger RNA vaccines, what are chimp adeno vaccines. Why shouldn't we be afraid of these? Why should we recognize these are the new and best ways to make vaccines? We have to explain why some people get reactions to the vaccines and what that means. What role does that play in terms of health status? We have to explain to individuals who are waiting for vaccines where they may have concerns, such as pregnant women. What data do we have? What don't we have? What can we share with them? So I think it's all about, number one, finding out what people's concerns are, addressing those concerns directly by telling the story, and making sure that we do address legitimate issues such as pregnancy and underlying disease conditions in terms of getting these vaccines.
There are rumors that food stamps could be tied to getting vaccinated. Do you know if that's even possible?
I have no knowledge of that and have no expertise to comment on that.
Do you support incentivizing people to get the vaccine, perhaps even paying them to get vaccinated?
I have not even thought about that. I think at this point, trying to prevent a serious disease and even a fatal disease should be the motivation that we should use for moving these vaccines forward. So in terms of any other programs, at this point, I think that's very premature to consider.
We've heard leaders, including Secretary Azar, talk about indoor dining as fueling these numbers, these surges. Would you support a nationwide ban on indoor dining right now, given the numbers?
First of all, there's no way I believe that you can actually enforce a national ban. I don't know how that would be done. At this point, each governor is deciding on his or her own. In many cases, it also involves local government as to what the problems are at the moment in their area, whether or not indoor dining is in fact associated with increased transmission. So I think it's best left to them to determine for their area what's the right thing to do. And that's what's happening right now.
Setting aside vaccines and mask mandates, what do you think the Biden administration needs to do on day one to stop these surges?
Actually, we're providing that kind of advice to the incoming administration. And at this point, I don't really have anything else to say other than that. And that we know that the transition team is considering the input from our group on a daily basis.
Are there actual priorities that have been put forward other than masks and vaccines?
I can't comment on that. There's a variety of discussions taking place right now with the transition team, and whether there's been other priorities or not, I can't comment.
One of the experts yesterday at VRBPAC at the meeting raised the concern about a pediatric vaccine and whether or not we can actually reach herd immunity without it. I'm so curious your take on it. Do you think we can reach herd immunity without a pediatric vaccine?
It'll be a challenge to get herd immunity without a pediatric vaccine, but I'm actually confident we're going to have a pediatric vaccine coming out. So I don't think at this point that's going to be the barrier.
When do you think that might happen?
I don't have any idea at this point. Surely the research is going on right now, looking at younger aged individuals than previously had been enrolled, and the age involved in these studies will continue to get to a younger age as more favorable information comes out with each set of studies.
I think there's a lot of confusion on what the biggest causes of these surges and the spread is at this point. Could you give us any sort of breakdown in terms of what the biggest causes at this point are? Is it indoor dining? Is it private parties, gatherings? What's really fueling this?
It really varies by area. We've seen, the epidemiologic data that's been collected by health departments, it vary based on what kind of activities are going on in a given area, how much outdoor activity versus indoor activity. I think the bottom line message is we just got to stop swapping air. That's what it's all about. Wherever you're in a setting where you're potentially breathing in the air that someone else just expelled out, where the virus is, that's what it's all about.
I think a lot's been made of this current administration, how it's handled COVID, especially from an optics standpoint, questioning experts, questioning masks. Is there anything that you would recommend to the Biden administration in terms of presentation, in terms of how to boost confidence and get Americans to behave the right way on day one?
We're having those very discussions, and I continue to look forward to providing that kind of input to the transition team. And at this point, I know that any number of things are being considered.
What would be your message to folks out there who wonder if anything will change over the next couple months, given that right now this is surging as badly as it has?
I'm confident that the incoming administration will use science as its currency for determining what to do and how to do it. And I think that's a very, very important message that the incoming administration does understand the importance of facts and science.
We saw a Republican representative, Jim Jordan, tweeting over the weekend, questioning Dr. Fauci, who was advising people against travel for Christmas. He said, "What is Dr. Fauci going to cancel next?" saying Merry Christmas. Do you think that that attitude that we have seen from certain Republican leaders is fueling the skepticism that's now bleeding into the polls that are showing 40% of Americans don't want to take this vaccine?
Yeah, I don't comment on what politicians say. I will comment on one thing, that Dr. Fauci has been a leading voice that has been responsible for saving many, many lives with his advice. And I urge all people to listen to him very carefully.
Any other advice as we head into Christmas?
Stop swapping air. Whatever you can do, make certain that you understand that's the way you're getting infected. And if you're in a place where someone else that you don't know whether they have been bubbled up as you have been, or eliminated any risk of exposure to them, if you're sharing air with someone you're not sure about that, then you're putting yourself at risk. Just stop swapping air.
What do you think of the fact that 5 people on the committee yesterday did not vote yes for the vaccine?
I didn't watch the committee proceedings, so I can't comment on why they might have taken that position.
Do you think there's any reason for people to have caution?
I think the vote was overwhelming. I find it very powerful in terms of that vote.